Next, we are going to leave the sideline and we're coming back to the prone position. And what I'm going to do on the prone position, show you some more bolstering technique, cushioning techniques that would work fantastic on about 95% of your clients. So in a way, it will help you in getting them better without doing a lot of massage into the shoulder area. And how does it work? Right, let's, I'll come closer. I just want to show and explain a few things. Right, so, now my question is such, what is the position of the shoulder in most of our clients? Is it forward or backward or forward. Upward, downward?
Up.
So it's upward and forward. Good. So ideally, if you find a way to take it backward, would be nice. Mm-hmm. Cool. Now, which muscles tend to be short in this position?
Pectoralis.
Sorry?
Pectoralis.
Pectoralis. And?
Deltoid.
Deltoid, the front of the deltoid a little bit. Sorry? Trapezius. Yeah. Elevation of the shoulder. Can you do that? Elevation and protraction. Forward. Yeah? Good. So pectoralis major and minor as well. What happened to rhomboids muscle?
Stretch.
It's stretch, but what happened to these muscles? They stretch, and in a stretch position, they contract. Yeah? So what we think is that either muscle is normal, stretch, or contract. A muscle can stretch and then contract while it's stretched. Yeah? Can you do that? Can you stretch this muscle? Do you feel the front here stretched? Yeah? Now can you contract it while it's stretched? Yeah. You can do that. So it's a bit of it's not a very good position for the muscle to do that, but it's possible. Yeah. So you can stretch a muscle. So this one is stretched and then contract it. Yeah. So that's what happened to rhomboids, and hence it becomes quite sensitive too. So how do we do that? How do we put the shoulder into a better position while we're massaging? You're using, again, your sense your imagination. You can create a bolster. Now, as every bolsters, our client comes in different size and shape, you need to adjust it accordingly. So that's what I like to use towels, because you can just make it thicker for bigger people or flatter for less. And what you're doing, you're asking your client, I'm going to put that underneath, yeah, good. And then you go on to the other side. Actually, let's leave it like that. Come close. And what I would like you to see from here, maybe the camera can also come from here, the difference between, low down, yeah, the difference between this shoulder and that shoulder. Do you see? Yeah, so come backward and see the difference between in the position of this shoulder. This shoulder is a lot more backward than that shoulder. So a client who comes with protracted shoulders, when you put the pillows there, automatically that's what happened, without you touching them. Yeah, again, lifting that, good. And let's do it properly, okay? How do you do that? You have to give them some idea that you're doing it. So you're saying, I'm going to put a pillow underneath your shoulders, yeah? Let me know if it's if it's not comfortable.
It is comfortable, thank
Yeah.
you.
Okay? So what can you do? Now you can do the massage as usual. You can do back of the body, the whole thing. And then when you come back to, you would see that you have a lot more freedom in these muscles, especially rhomboid, yeah, because it's just in its normal place. It can be after a long time that it would be just a normal place. The shoulders back, everything's fine, yeah. So I'm not going to show you effleurage back dressage. We just done it, yeah. So what I would like to show you is more mobilization technique, okay, and oscillation technique. So first of all, have we done this one? Yeah. Okay. So I would like to elaborate on that. You take that, and then. So what you do, you create a separation between the ribs and the shoulder. So I'm holding the humerus, it holds the scapula here, and then on that I move. Do you see what happened to the rib? Yeah? It's like a jazz dancers, yeah? They kind of do that, yeah? Now why is it good? This area, usually the thorax is usually the area that gets very tense, and it doesn't move enough. And the area that do move too much, neck and lower back. Where do we have most pain in the spine? Neck and lower back. Yeah. So what happens is that we always treat these two areas, but not enough increasing the mobility. Yeah? So this is a rib cage. It doesn't move well. These are the area that we abuse moving. So yes, you can relax this area, but also work to increase the movement here. So ribs mobilization. Yeah? You can do it this way, you can do it that way. If I do that way, one hand here and one full hand here, and then I alternate in between. So actually it comes from my body. You see? I don't move hands only. I can do that if I want to do it quickly, but if not, I use my whole weight. Yeah? Okay. Now I'm coming to the upper area. Yeah? And I'm taking two fingers and I locate them between the spinous process of the vertebra. Now what is it, the spinous process of the vertebra? Is the bit which we feel. You don't feel the vertebral body. You don't feel the disc. You don't feel a lot of the vertebra. What you feel is just the bits that sticks near the skin. This is called spinous process. It's the process that is of the spine, yeah? And you're taking the two fingers there and you start moving it. On some people it will be easier than others, but I want you to just feel that, and what I want you to start feeling is a light, when you do that, I want you to feel the gap between the spinous processes. Now, it is a gap. There is a gap between the vertebra, and this gap is full of ligament. What I want you to do is just go and mobilize very lightly each vertebra. Shake them, wake them. Good morning. Move it separately. Yeah? So it's very light, but very, very specific. You are holding the vertebra in your fingers and you're just moving it. Health and safety. Who we are not going to do this technique on?
He's got a slip disc.
Slip disc.
Scoliosis.
Osteoporosis.
Osteoporosis. Do you see why? Osteoporosis, yeah? What, yeah, you potentially can do. Usually I would say this way. If your movement, the amount of movement that you do on their spine cause them the break, they will have, cause them the fracture in the vertebra, they will have the fracture before, whilst they're carrying their weight of the head. But we don't want to take any risk, yeah?
What
So
with rheumatoid arthritis?
rheumatoid arthritis is more dangerous in the neck, yeah? Here, as long as there's not severe tenderness, do it. You can do that. Someone says scoliosis, I would say in the acute, severe pain, don't. But if they don't have it, if they just have it, and yes, they have a back pain, you can do it. Backache, yeah? So anything severe, anything acute, you do not do. Anything mild, except osteoporosis that you don't do at all, possible, okay? Okay. Then after that, once you get confident in moving, you can do it also with the base of the wrist. So I want you to work closer to the spine and really feel the spine. Don't be afraid to feel the spine. Yeah, especially this area. That's it, really. Put that cushion, and I want you to be familiarize yourself with this technique. It's very good. You know why? Because it's very easy. And shake it slowly. Get the feedback from your client about what is best for them. Okay, get some momentum on that. Okay, let's start.